Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Hi, thank you for joining us today for this episode of Being Well. I'm your host, Keanne Armstrong, and I'm joined today with our special guest, Dr. Jessica Prange, and she is a cardiologist with Prairie Cardiovascular Consultants. Thank you so much for joining us today.
Thank you for having me.
So we're going to be talking today about cardiovascular disease in women.
Yes.
And why that's so important. So why is it so important?
Well, cardiovascular disease is actually the #1 killer of women in the United States. And that's a statistic that a lot of people don't know. And actually, a woman is 10 times more likely to die of cardiovascular disease than they are of breast cancer. And actually, more women die of cardiovascular disease than all forms of cancer combined. And I think most people are shocked by that.
Yeah.
Obviously we worry about cancer, and that's a big bad thing, but you are more likely to die of a heart or cardiovascular related issue. I think part of that is we just haven't done as good a job as the breast cancer folks as getting that awareness out there. We're working on it, which is why we're doing things like this taping today and our discussion. The biggest question I get from patients is why? Why is that the case? We don't really know, but a lot of it stems from, well, first and foremost, most cardiologists don't look like me. So only about 20% of doctors training to be cardiologists are women. So maybe that plays into it a little bit. And also, women we know don't always present the same way, with the same signs and symptoms as a man would when they're presenting with cardiovascular issues.
So what are some of those differences?
Yeah, so women tend to present with kind of more subtle symptoms. It could be that they're having more fatigue and not normal, I didn't sleep well last night. Fatigue during doing activities that wouldn't normally cause you to be tired. Okay. More shortness of breath. There's a lot of women that never have a chest pain. So that makes it really tough to pinpoint. And what we know is women tend to present later, so they don't seek care right away. I think women have sometimes almost like a caregiver syndrome, which isn't a real thing, but what I hear patients say is, I didn't have time to be sick.
Right.
A lot of times they're taking care of a ill spouse, an elderly parent, a sick child, and they kind of put whatever is hurting them or not feeling right on the back burner. And so they tend to come in later. And because of that, if they do have cardiovascular disease, we tend to not do as well. So we're more likely to die. We're more likely to have complications related to our heart-related issues. So all of that together makes it more dangerous for women to have heart disease.
It does, and I'm glad we're talking about it today to help folks understand, especially women, not that we're discounting it with men.
No, of course not.
Today we want to talk about that sort of exhaustion because, I think to myself, and a lot of women that I know, we have a lot of things that we do during the day.
Absolutely,
and I'm just exhausted. But that may be more than what meets the eye.
Yeah. And most patients, they know their body better than we do. So when a woman comes in and say, this isn't right, I'm just not feeling like myself, that is usually, sets off bells and whistles in my mind that it takes a lot for most people who are busy and taking care of other people to really stop and say, this isn't right. So we have to, as doctors, take that very seriously.
Okay, so since we're talking about this subject and we're talking about these are a few of the symptoms, what exactly is cardiovascular disease?
So that's a very good question. So cardiovascular disease is a term that we throw out there a lot, but it's really kind of a blanket term or an umbrella term. And if you break it down, so cardio means heart. So as a cardiologist, we deal with obviously the entire structure of the heart. And the heart is kind of like a house. So you have your foundation, that's the heart muscle, and inside that you have valves that direct the flow of blood. You could have problems with those. So if you have a weak heart muscle or a stiff heart muscle, you could have things like congestive heart failure, which I'm sure you've heard of. Mm-hmm. You could have a tight valve or a leaky valve. So that's the foundation. Then we also have the plumbing. So the plumbing is like the arteries of the heart. So when we talk about heart attacks and coronary artery disease, it's really a problem with the blood vessels. There is the electrical system of the heart. So that's where we talk about palpitations and heart rhythm problems. And then there's the structures around the heart. So the heart sits in a sac called the pericardium, which also can have problems. So that's the cardio part of cardiovascular.
Okay.
The vascular part means blood vessels. So we also specialize in diseases of blood vessels throughout our body. That could be the aorta, which is your main artery supplying blood to your whole body. That goes to your legs. So a lot of times people will have pain and cramping in their legs that they think is either a muscle problem, a joint problem, and sometimes it's actually because they have blockages in the leg arteries. Also, the arteries of the neck, your carotid arteries. So we deal with a lot of different disease processes that go with cardiovascular disease.
Okay. Well, so it's very detailed, and it's probably kind of hard for a person to say, hey, this is what I'm feeling, and I just don't know that this might be a problem. Maybe I just walk too much, or,
Sure, absolutely.
exercise and different things like that. So what about stroke? Because that falls into play when you're talking about blood clots and the flow of blood and different things like that. Am I correct?
Absolutely. So stroke is part of a cardiovascular specialist area of expertise. So we work alongside our neurology colleagues to first and foremost treat you to make sure that you have the best outcomes, and also how do we prevent it, and how do we know what caused it in the first place? Because it's really hard to prevent another stroke or mini stroke if you don't know what caused it. So we help the neurologists figure that out. So a stroke is divided into two different categories. So the first category is the most common, which is called ischemic, which means that a blood clot essentially has traveled somewhere from the body to the brain and you're not getting as much blood flow as you should. The second causes a bleed in the brain. That's much less common, and the treatment of which is different. So common causes of stroke that we deal with. So one we had already mentioned, which is the carotid arteries. So if you have plaque, and that means cholesterol plaque buildup, if that becomes severe or that plaque goes somewhere it's not supposed to go, that can obviously cause a stroke. We look for subtle things like holes inside the heart that can increase your risk of a blood clot traveling to the brain. Sometimes if there's a hole in the heart, we actually have to close that hole. One of the most common causes of a stroke that people do the whole workup and we can't find anything is actually a rhythm problem called atrial fibrillation. Mm-hmm. It's extremely common, and sometimes it's hard to catch because it comes and goes. Mm-hmm. And that's an irregular heart rhythm, and it actually allows blood to kind of sit inside the heart, and that makes a blood clot form.
Okay.
And if that blood clot would move and go to your brain, obviously that can cause a stroke. So we typically have folks wear like a heart monitor at home. We actually have now a heart monitor that goes underneath the skin right on your chest, and it can monitor your heart rhythm for 3 years continuously.
Wow.
So if you have AFib, we're going to catch it because it's important. If you have AFib, we treat you very differently. People would have to be on blood thinners, and that can prevent people from having another stroke. So it's a big deal.
It is a big deal. Mm-hmm. I have a family member who's struggling with that right now, and it's scary because it's exhausting when your heart goes out of rhythm and
Absolutely.
you don't feel good.
Yeah. Amazingly enough, there are some people that have zero symptoms when they're in atrial fibrillation. A lot of times it's picked up incidentally, like they get an EKG for, pre-op surgery, or their doctor hears an irregular heart rhythm. And then there's some people that know the second they go into AFib. Yeah. They know the second they go in and the second they go out. And there's everybody in between. So it's not a one-size-fits-all diagnosis.
So it's all very different. Going back to the stroke, what are the warning signs of a stroke? What should people really pay attention to?
This is very important. This is probably the most important thing when it comes to stroke. With cardiology, we have a saying, time is myocardium, meaning, the sooner we can get your blood vessel open, we can save that heart muscle. With stroke, time is brain. So what you would notice would be a sudden change in a neurologic symptom. That could be something as simple as slurred speech. Some people will say that they know what they want to say, but they can't get the words out. More obvious things are a drooping of the side of the face or an eyelid, or weakness or abnormal sensation, particularly on one side of the body. Those would be the warning signs. So it's very important to not wait. So nobody will ever fault someone for coming into the emergency department or calling 911 because they're having a change in a neurologic symptom. Because our treatment actually depends on the timing of the symptoms. So that's changing a lot. It's kind of a moving target as far as how soon after the symptoms started that we can give those clot-busting medications. Those can actually be life-saving and prevent people from having severe, debilitating issues after the stroke. So don't wait.
Don't wait.
That's the bottom line.
So should they go straight to the ER? Like what is the route they should take to get help?
Don't mess around. Don't call your doctor's office. Call 911 or get to the emergency department. That's going to be the place that's going to be able to tell you, yes, you're having a stroke or you're not.
All right. Now let's go back and talk about folks who may be experiencing symptoms of a heart attack. So we've talked about stroke. What about a heart attack? What are the warning signs there, and what do people do?
So the classic warning signs or symptoms are kind of easy to pick up, and those are the straightforward ones that we all as cardiologists wish that people came in the door with. So when I give talks to the public on this, I say, now if I told you that someone in this room was having a heart attack, could you look around and pick them out? And most people in their mind think of kind of a middle-aged guy who's pale and sweaty and clutching his chest and short of breath. And you could go, yeah, that guy's having the heart attack. And that's easy for doctors when they walk into the emergency department. That doctor is going to say, okay, I think you're having a heart issue. We're going to do X, Y, Z. That's not always the case, especially for women, especially for diabetics. So some of those things that we talked about earlier about more subtle symptoms. So I give an example of my grandmother. So it was my wedding day, and the grandmothers were supposed to walk down the aisle and, do their whole formal thing. And someone had come to me and said, Grandma Mary doesn't really feel like walking down the aisle. Is that okay? Absolutely, just have her sit in the pew, not a big deal. And she, God bless her, she drove to the church, she sat through the ceremony, she did all the pictures pre and post, and come to find out that whole day she really wasn't feeling well. She was a tough farm girl, raised 6 kids, so pretty tough lady.
Yes.
Didn't exactly care for doctors too much. So, and she was a smoker and a diabetic and overweight, high blood pressure, high cholesterol, all the risk factors.
Yes.
And she just wasn't feeling well, and she was tired, and she kind of felt sick to her stomach. So she thought she was coming down with a flu type illness. Went to the reception and apparently spent the whole time in the restroom, throwing up. My uncle took her home. Of course, they didn't tell me. I was a medical student at the time, and I definitely would have been alarmed. So God bless them, they didn't want to ruin my day. They tried to get her to go to the emergency room then, and she wouldn't. She went home. The next day, still not feeling right. Eventually agreed to go to the ER. The doctor did the workup, the blood work, the EKG, and she was having a heart attack.
Wow.
And she actually went up to Springfield St. John's Hospital, and a Prairie heart doctor put a stent in her. So my journey to become a Prairie cardiologist has come full circle, and I'm very proud to be part of this organization. But it just goes to show you, in a million years, she wouldn't have guessed that she was having a heart attack.
Yeah.
She never had a single chest pain.
So it can be a lengthy process.
Can be. She's, in a way, very lucky that she was able to kind of stretch that out. Some people are not so lucky. A decent amount of people, their first presentation of a heart attack is actually sudden cardiac death.
Right.
So she was lucky in that she had time to kind of wait it out and seek treatment, but not everybody is that lucky.
Well, there's a friend of mine, actually a coworker, has struggled with some of this cardiovascular disease as well, and it's scary after you go through something that you didn't know was part of your makeup or your workup of your system, and it's the anxiety, I think, that gets to people afterwards. Like, what am I missing? What do I need to pay attention to? Because I can't see inside my body. So what do you tell people that are struggling with that?
That's a huge issue, actually. First of all, follow your doctor's instructions, obviously. Take those medicines that are prescribed to you. If you have a chance to go through the cardiac rehab process, so most people, if they've had a stent or bypass or a heart attack, get referred to cardiac rehab. Sometimes that can ease a lot of the stress and anxiety about getting back into the world. What can I do? Can I exercise? Can I be intimate? Can I do those things that I used to do? And cardiac rehab is a supervised exercise program. So they start you off slow and they build up your confidence, and they monitor your heart rate, blood pressure, EKG, so that people can feel like they're confident in what they can do to get back in the world. Some other things to watch out for. So we get very alarmed about symptoms that come on when you're exerting yourself. So I tell people life is a stress test, right? So if you're going up a flight of stairs or you're walking in the grocery store and you start noticing similar symptoms to maybe what you had before, whether that's chest pain or pressure, or if it's more of a shortness of breath or getting sweaty during something that shouldn't cause you to be sweaty, those are kind of those warning signs that we need to know about it so we can catch it before it gets bad again. What I tell people too is that usually the same warning signs that someone had before, it's going to be similar within the same person. Now your symptoms might be different than your neighbors, but within the same person, they're usually going to be very similar.
Okay. Well, what about if a person wants to feel the same that they did before they had something like this or had a stent, and they feel like they're slowed down and they're like, how come I just don't feel like I did before? What do you tell people?
Well, there can be a lot of different reasons. First and foremost, if the heart muscle actually had a lot of damage done, that can take time for that to recover. And also, after a heart attack, we put people on a lot of medicines. Unfortunately, we don't have one magic pill that combines all the good things of all of our medicines. So people are generally on a lot more medicines than they were on going in. And those medicines have side effects and tend to lower blood pressure, lower heart rate, and that can really change the way someone feels.
And slow them down on purpose.
Absolutely. So getting back on track with exercise like the cardiac rehab, and a lot of the medicines, their side effects will go away over time. You just have to push through it. And like you said, with anxiety and depression, we actually see a lot after heart attacks, especially after things like bypass surgery. Depression is under-recognized a lot of times. So it's actually part of our screening process when we see somebody after a big heart surgery. And that can make you feel sluggish and tired, obviously. So there's a lot of different things that go into it.
Okay. So what can women do to prevent heart disease or cardiovascular disease, however you want to?
So that's the million-dollar question, right? Yes. Because none of us want to go through those bad things. So I kind of divide it into things we have control over and things we don't have control over. So as much as we all feel 18 years old inside, we're not. So you can't control your age. You can't pick your family. So if you have a family history of heart problems, you just have to deal with it and realize that your risk is higher. Then there are the things that you do have control over. Probably the number one thing is smoking. People feel like they don't have control over it, and I think that goes into why it's so hard to quit. But that is probably the number one thing that you can do as a person, if you are a smoker, to cut back and stop smoking. It is very hard to do, and talk to your doctor about it, because we've got some tools in our tool chest like medications, nicotine replacement, other helpful resources. So there's that piece. Obviously, there's the diet and exercise part. That is obviously easier said than done,
right.
as we all know. I tell people, if that was so easy, there would be no fat cardiologist, and unfortunately that's not the case. But it doesn't mean that it's not important. So most of the time we say you should do some type of activity that gets your heart rate up for maybe 30 minutes to 60 minutes most days of the week. That's going to be different for every patient, because some people, they're starting off at a much lower activity level, and you got to build up to that. And it's not that you got to go 30 minutes straight on a treadmill. Little changes make big rewards. So as simple as, instead of circling the Walmart parking lot for 10 minutes to find that close spot, park in the back.
Right.
Force yourself to do a little bit of extra walking. Instead of taking the elevator, go up that flight of stairs. So those little things can make a big difference.
Absolutely. Get up during your work day and walk around.
Absolutely.
Or don't try to carry all the bags from the grocery store in one trip.
Yeah. Although I do think that's a badge of honor if you can carry all your bags in from the grocery store with one trip, but it doesn't often happen.
Right. So what resources should people seek out? What's out there for people to educate themselves besides what we're doing today?
Yeah, well, obviously, if you have a primary care doctor, they're a great resource, and they can help navigate as well. Is this something that needs further testing? Do I need to send, Mrs. Jones to the cardiologist? If you want to just look on the web, there's a lot of great resources out there. One that I love is the Go Red for Women campaign. So that is our attempt to try and get that message out there about women's cardiovascular disease.
Why we're red today.
Absolutely. I've got my little pin here if you can see it. So that is our logo, the red dress. So if you ever see that, that means that we're trying to get that message out about women's heart disease. And they have a website, I believe it's goredforwomen.org. And they've got a lot of great resources, things on diet, exercise, specific cardiac diagnoses, and also information about tests. So people have a lot of anxiety about heart tests, and this kind of runs them through what to expect. Okay. Obviously, we have our Prairie Heart website. So if you Google Prairie Heart Institute, we've got a great website up for patients. It's got information on doctors, our locations, also those things like diet and exercise and tests. We actually put out a publication called The Well-Fed Heart. So it's a little pamphlet that you can get, or it's on the web, about healthy exercise, recipes, that sort of stuff.
Okay.
And we also have an app that you can download from there to help.
We have just a couple more minutes left. So speaking of diet and exercise, one thing that I hear a lot about is high cholesterol. Mm-hmm. So how does that play into all of this as well?
Absolutely. So this is a daily struggle for me as far as educating patients on cholesterol. So when we talk about blockages in the arteries, we're talking primarily about cholesterol plaque. So when someone has a heart attack, when they need a stent, when they've got plaque buildup in the neck arteries, that is cholesterol. We've really changed the way we treat high cholesterol now. We really used to focus on the numbers, and you say if you hit this number, you get a cholesterol medicine. And we've really shifted the way we treat people, because now what we understand is there's actually a group of people that have completely normal cholesterol numbers, and they come in with a heart attack. Mm-hmm. And we look at their arteries and they've got tons of cholesterol plaque. And that doesn't make intuitive sense for most people or doctors. So we have decided that the best way to treat cholesterol is actually on your risk. So if we know you have blockages in the arteries, especially diabetics, and other groups of people, we know that your risk is high. Therefore, you should get a cholesterol medicine. So it's a lot different than it used to be. people are really scared of cholesterol medicines. They've gotten a bad rap, probably unfairly. They really help reduce your risk of heart attack and stroke. So that is why your doctors, in particular cardiologists, push so hard, because we don't want those bad things to happen to you.
Okay. Well, thank you so much for joining us today. I believe this has been very educational. Right. I hope that if you were watching today's episode of cardiovascular disease in women, that you are paying attention to your body, you're eating right, you're taking care of your health, and you're listening to your doctor. So thank you, Dr. Jessica Prange, once again from the Prairie Cardiovascular Consultants, for joining us today, and thank you so much for watching.
Production of Being Well is made possible in part by
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.